Hi, my name is Lindsay McComas. I'm a Torrey University nurse practitioner student, and today I'll be conducting a neurological exam on a 48-year-old male with the initials of MM. Hi, my name is Lindsay. I'm going to be your nurse practitioner student today, and I'll be conducting your neurological exam.
Okay.
Perfect. If it's okay with you, I'd like to go ahead and sanitize my hands prior to your exam.
Thank you.
So, first thing I would like to do is assess your ability to smell. So what I'm going to have you do, if it's okay with you, is I'm going to plug one of your nares, have you smell a substance, and then plug the other nair and have you smell another substance and tell me if it's equal on both sides.
Okay.
Okay, perfect. Okay. Eyes closed, please.
Mhm.
Plug this nair.
Alcohol.
Okay.
Alcohol.
Is it the same on both sides?
Yeah.
Perfect. So olfactory is bilaterally equal. So what I would like to do now is assess your visual field, which is going to be cranial nerve number 2. So what I'm going to have you do is, if you don't mind, this is a Snellen chart. I'm going to have you hold that at arm's length with both eyes open. Read the lowest line you can.
ECTPNL.
Perfect. Go ahead and cover your left eye.
ECTPNL.
Okay. And cover your right eye for me now.
ECTPNL.
Perfect. So now what I'd like for you to do is I'm going to have you follow my finger with your eyes in a couple of different motions, okay? We're assessing nerves 3, 4, and 6.
Okay.
So with your left eye, I'm going to have you go follow my finger.
Okay.
Perfect. Go with the other eye. Okay. No problem there, no strabismus, no nystagmus, no issues symmetrical. So no problem there. So what I would like to do now is just check your trigeminal nerve. And by doing that, what I'm going to do is I'm going to have you close your eyes.
Okay.
And I'm going to use a cotton swab to just touch your face lightly in 3 different places on each side of your face. And I want you to tell me if you can feel it.
Okay.
Okay, perfect.
Yeah, I can feel that. I can feel that. I can feel that. I can feel that. I can feel that.
Okay, perfect. Okay, so in moving on, what we're going to do now is I'm going to go ahead and conduct a hearing test on you. So it's going to be 3 different little tests. So what we're going to do first is called the Weber's test. So what I'm going to use is this tuning fork, and what I'm going to do is I'm going to place it on your surgical sinus, and I want you to tell me if you hear it more in one ear or the other,
Mm-hmm.
or if you hear it in both ears.
Okay.
Okay?
I hear them both.
Perfect. So the next test that I'm going to do is the Riney test. And what I'm going to do is I'm going to place the distal end of my tuning fork on your mastoid muscle, or on your mastoid bones. And then I'm going to place it in front of your ear. And I want you to tell me when the ringing stops.
Okay. Stop.
Stop.
Mm-hmm. Stop. Stop. Stop.
Perfect. So that's exactly what we want to see. We want to see the air conduction over bone conduction is beneficial at this point. So that's exactly what we want to see. So thank you for that. So what I'd like to do now is do something called the whisper test. So what this is I'm essentially going to close one of your ears. I'm going to whisper 3 numbers, and I'd like for you to repeat them, okay?
Okay.
So I'm going to start with your left ear.
Okay.
Okay, so I'm going to close your right ear if it's okay for me to touch you.
Sure.
66, 44,
66, 44,
39.
39.
Perfect. Okay, I'm going to move to the other ear now. Same thing. 42,
42,
16,
16,
7.
7.
Perfect. Okay, great. So, how do you feel about that?
Good.
Good. Okay, so now I want to move on to assessing just some other facial features of yours.
Mm-hmm.
So, in doing so, I'm going to have you do a couple of different facial exercises.
Okay.
Okay, so I'm going to have you tighten your eyes. Perfect. And scrunch up your forehead. Excellent. And puff out your cheeks. Great. And clench your teeth. Okay. And go ahead and give me a smile. Excellent. So everything appears to be symmetric at this point, and that's going to be cranial nerve number 5. So next that we're going to do is we're going to check your gag reflex and your swallow reflex. So
Okay.
I'm sorry, this is going to be a little bit uncomfortable,
Okay.
but I'm going to use this straw. I'm going to have you open up, say ah. Gag reflex is intact and within normal limits. Next thing I'm going to do, if it's okay with you, I'm going to touch your throat and I'm going to have you swallow.
Okay.
Okay, go ahead and swallow. Okay, symmetrical. The last thing that I'm going to have you do is I'm going to check cranial nerve number 11, and I'm going to check your shoulders. So what I'm going to do is I'm going to put my hands on your shoulders, and I'm going to have you try and push against me.
Okay.
Okay? Don't let me push you down. Go ahead. Perfect. So symmetry is noted there as well. So we'll see what we can do for you and continue to take care of you.
Okay. Thank you.
Do you have any questions?
No.
Perfect. Thank
Thank
you
you.
so much.